How do you triage headaches in patients receiving immune checkpoint inhibitors? Patients may report a headache at any point during treatment. Headaches may be mild, intermittent, sharp, or constant. The onset may be variable according to or dependent on a specific cause. Patients may have acute onset headaches, which are the most troublesome, or they may also have chronic headaches. It's important to assess any associated symptoms that may help you to diagnose the etiology of a headache. And these include things like nausea, vomiting, light sensitivity, visual loss, any neurologic alterations, or neck pain. Differential diagnosis can include brain metastases, stroke, CVA, anxiety or stress, migraine, anemia, hypovolemia, hypotension, and hypertension. There may be some other immune-related adverse events such as optic neuritis or hypophysitis. They may also contribute to a headache. Adrenal insufficiency, in addition, may also lead to a headache. Some of the danger signs that you really need to look for or consider when evaluating a headache can be evaluated using an acronym called SNOOP, S-N-O-O-P. S stands for systemic symptoms. You want to evaluate for any other associated symptoms, any other illnesses or conditions. N is for neurologic symptoms. Is there confusion, altered level of consciousness, papillary edema, any focal signs or seizures? Onset. So with onset, some of the higher risk factors are new acute headaches, particularly in patients that are over the age of 50, or sudden onset of a headache, such as a thunderclap type of description. And O is another cause, such as drug use, trauma. Is the headache worse with Valsalva maneuvers or cough or exertion? Those are very troublesome and concerning for stroke. And the P is there a previous history of headache? So oftentimes patients have cyclical headaches or a long history of those, and those are a little less troublesome for us. Evaluation is going to be dependent on the urgency. So that's the onset and the other symptoms we talked about of assessing. You want to do a full neurologic evaluation. An MRI of the brain with pituitary cuts is necessary. In some cases of stroke evaluation, an MRA may also be required. There are some cases that patients are not able to have an MRI. Perhaps they have some implantable medical devices, such as like a pacemaker or a defibrillator. And in those cases, you'll need to rely on a CAT scan. Management will be dependent on the etiology. If the patient is hemodynamically unstable, they will require hospitalization for full evaluation of the headache.